We know that 1 in 10 hospital experiences result in an adverse clinical event. In fact, 1 in 100 result in either death or injury. This can greatly be reduced if we place a heavy focus on patient safety by doctors and nurses working differently with patients, by being open and honest with them where an adverse event occurs, because this will minimise the chance of it happening again. Here in Ireland, we've had a number of inquiries into adverse clinical events. We need to learn lessons from those inquiries, and that's what we're doing. We're being proactive now as a result of what we know in putting in place a patient safety first agenda involving healthcare professionals, patients themselves, and it's only by placing the focus on the safety agenda, as they've done in other industries like the airline industry and the food industry, that you can dramatically improve the outcomes and the results and minimise the possibility of adverse events happening in the first place. Essentially, what we require is healthcare professionals to work differently together, to be more conscious of the patient safety agenda, to follow a basic checklist of procedures to be followed, particularly in surgery. It's a very exciting time now to move forward the agenda because we have the support of so many of the healthcare professionals to work and do things differently. Notwithstanding the economic challenges we face in the country, and particularly in the health service, I believe putting the patient safety agenda at the centre of everything we do is about saving money, because adverse clinical events result in patients being longer in hospital or maybe having to have a second or third procedure. So patient safety is a winner both from the perspective of the better outcome for the patient, but also saves the health service money. And essentially what we're seeking to do here is to have those that work with patients, healthcare professionals, doctors, nurses and other professionals, work differently, being focused on the patient safety agenda, following clinical protocols, adhering to the standards that we're putting in place, and eventually in 2012, which is not that long away, we will have a licensing for all healthcare providers in Ireland, beginning with acute hospitals, and only those hospitals that follow appropriate clinical guidelines and meet the standards will be licensed to carry out particular activities. And that will guarantee that right across the country we will have uniformity in the way that patients are treated in our hospital system. The patients will require the healthcare professionals to be open and honest with them. If an adverse event happens, the patients should be told about it, and that will be a requirement. And that will minimise the possibility of the same event occurring a second time. Patients will be asked for their response to their experience, whether it's a positive response or a negative response. And if it's a negative response, clearly we have to learn the lessons from the negative response and maybe make changes on the basis of the feedback from patients. Like any good business, the patients are our clients and we must listen to them, and we certainly will.